So welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. I would like to propose a motion to adopt the minutes of the Audit Committee meeting held on December 2nd, 2024. Dr. Katz?
Yes.
Frida Wang?
Yes.
Again, yes. So I move a motion to enter into an executive session to discuss confidential and privileged matters that may be related to threatened and potential litigation. Second? All in favor say yes.
Yes.
All say no. So thank you, everyone. So I ask that only those specifically invited proceed to the adjacent conference room. So we're back from executive session. So now we will have an audit update from Mr. O'Keefe.
Okay. The first audit we have is the correctional health audit that's going on. The audit's ongoing at this point. We just got a request for a sample of 300 patients. They had a long time getting a data sharing agreement so that the patients could be or prisoners' patients could be de-identified with the sample. So just work that out, and we're providing them data on this. Correctional health, audit language access, and behavioral health are at the same point. We just received preliminary reports with them. We will be going over a response that will be due to them, to each individual authority. The last thing we had is the number of audits. We have one audit completed for the year. There are a total of 5 audits on the schedule. 3 are in progress. 1 is not started, but is just starting now, and that's an audit about human resources. The auxiliary audits. We are in the process now with talking with the firm, the Bonadeo Group, that does these audits. There's been a long lag in them not completing some audits from 21 and 22. We're working with them and trying to get them completed or find out whether they're going to complete them or not. Do we have to have something else done? But we are in the process of doing that right now. That is mine, unless anybody has a question.
Thank you. Any questions from committee members? Thank you so much. And now we have compliance update from Catherine Patzes.
Yes, so to start off with, I just want to touch about some of the things we've been doing. I've been meeting with the CEOs of the facilities and programs to do one-on-ones with them like I do every year, go over their the coal fire HIPAA risk analysis findings for their facilities, and also discuss their compliance and privacy cases metrics, our workforce member compliance survey results, and the risk assessment that we're doing for SY 2026, and let them know what the completion results are for their compliance and HIPAA training. We also, as I reported last time, there is the reproductive health information regulations that are require confidentiality to obtain attestation from requesters of PHI that are made for any of these 4 reasons. And the attestation must clearly state that the use or disclosure of the PHI is not for one of those prohibited purposes. And we have prepared for the implementation, but we have a draft, it's not final now, attestation that we are using and a cover letter that explains to the requester why they need to complete the attestation. We did our third workforce member survey at the end of 2024. Our response rate was higher than last year, but we still want to increase the response rate and we're considering using a vendor for them to use their tool, which might get us higher response rates. Some of the highlights, there was an increase in the percentage of respondents who knew how to contact the Office of Corporate Compliance and their compliance and privacy officers. They still go to their officers and managers for questions about compliance concerns. There were only a few who did not feel comfortable raising compliance concerns. And one of the reasons was fear of retaliation for raising complaints. A majority of the respondents believed that our compliance training was valuable, providing good guidance on how to act appropriately, and they recalled key lessons. And more than half of them want to see more electronic communications from the Office of Corporate Compliance. Our training completion rates system-wide for the privacy training was 87% and 71% for the general compliance training, which was rolled out later than the HIPAA training, and we hopefully will do better this year on that. As for the compliance report metrics, these are for the full years of 22, 2023, and 2024. So we are increasing our compliance cases, which is a good thing because we do want people to talk about their compliance concerns. The next case is the privacy reports. This says increase, which is not what we want to see, but these are also cases that are not necessarily substantiated, but they're all just reported. So it doesn't indicate an increase in reports. And finally, we have this shows that we have a culture of people who choose to disclose their identity when they're making complaints or reports, which is very good because it certainly helps us to substantiate or unsubstantiate and to investigate the cases that come to compliance. Any questions?
Any questions? Okay, thank you so much, Catherine. And is there any old or new business to come before the committee? Hearing none, meeting is adjourned. Thank you.
Thank you.